Hello, everyone. Welcome back to the Rise to Your Peak podcast. I am here with my guest today, Dr. CeCe. How are you doing today?
Hey, I'm so good. So happy to be here. Thanks for having me.
Absolutely. Thank you for being here. Um, this is an exciting episode. Uh, like I was just saying to you, first time that we've had a functional pediatrician on the podcast. So I know there's going to be a lot of viewers excited about this episode. So let's dive right in. If you don't mind, give us a little insight about yourself, where your practice is, a little bit of backstory, and we'll go from there.
Yeah, so I run a functional medicine practice in Cumming, Georgia. So we see patients of all different types. We do have chronically ill patients, our adults and children, kind of unsolved mysteries that we specialize in trying to uncover the root cause and truly, gain strength in their journey towards healing, and actually figure out what's happening.
Yeah.
The other side is our pediatrician side, and we act as, I do air quotes, a conventional pediatrician office, because we do all the things that normal pediatric offices can do, but we are absolutely holistic minded. So everything that we do, it has a root cause approach. If there's a kid with constipation, we are not just smacking Miralax. We're
Yeah.
actually figure out why that kid is constipated. We pay a lot attention to setting kids up from the start, because that first 3 years of life is crucial for the rest of your life. So
Yeah.
setting them up from the start just for health and wellness. So we're very holistic minded in that sense. Even with acute visits, it's how can I avoid certain conventional medications if possible, use natural remedies, and then there's always a line of, okay, then how do we support this kiddo if we do need an antibiotic or something like that. So we kind of have two sides to the practice,
Yeah.
but I love it. And
Yeah.
my own health journey kind of landed me there, is I was very conventional minded when I was kid growing up and even in the first part of school. And then I started to become chronically ill around 20 years old. And from 20 to 27, I was bedridden by the end of that kind of 7 years of my life. And conventional medicine, in my opinion, really failed me along that way. So it wasn't until I turned to functional medicine and actually found what was going on, which I had chronic Lyme disease,
Wow.
and that was reversed and healed. And here I am to kind of just share that approach with the world. So that's definitely what landed me on this side of things.
Oh, I'm sorry to hear you went through that. Similar myself, and I think we can probably say that almost every passionate, skilled, functional practitioner has gone through their own journey.
100%.
You know, I've yet to meet someone who's really up there, super passionate, and they're like, "No, I've been healthy forever." Like that. I just haven't seen that yet. So yeah, we've kind of all been in the trenches and learned from our own issues. Um, but I love this aspect of your practice. I'm curious, how is that received? Do most people come into it knowing that already, knowing that there's both sides, or are some people surprised, like, what do you mean root cause? You're not just giving me a medication? Like,
Right.
you know,
You
how does
know,
that work?
Yeah, full transparency. I think most people who seek us out for a reason.
Okay.
And I do think full transparency, it's very hard to take insurance as a practice and as a medical practice when you don't follow insurance
I was going
guidelines.
to ask that. Yeah.
So, I mean, I would get booted from insurance companies in 32 seconds because I don't follow their regimens. I don't
Right.
follow their timing. Even for well visits, it's at least 30 minutes where we actually want to get to know the patient and their family and the history and what makes, them them. And so I can't take insurance for that reason. Most of my patient population does not vaccinate. So for that reason, I also can't. And so I think people know when they first initially call, hey, if I'm going to spend money, my hard-earned money, instead of going through insurance, that this is the type of practice that I'm seeking out. So they truly do expect that holistic approach. They expect us to go above and beyond,
Yeah.
above just milestones, and really dive deep into their kids' health and be preventative for them in that sense. Once where it takes a turn, where some people might be like, huh, this is interesting, is if they do come to us already having chronic symptoms, I'm already shunting them to the functional side and
Yeah.
saying this is not something that we're just going to give a quick fix. This is something we're going to dive deeper. And some parents are like, oh, interesting, tell me more. And some are like, wait, I'm still just used to a quick fix.
Yeah. Give me
What
that
does
quick
this
fix.
mean? And yeah, and it's just about education.
Yeah.
honestly, at that point.
Yeah.
But I do think most people seek us out for a reason.
But no, I mean, I totally understand that. And I feel like our online clinic is very similar. You know, the people who find us are finding us for a reason. And to that point, because we're online, we do get a lot of DMs and messages, or emails. Do you guys take insurance? And that's a conversation we have to have. I've said this on many podcasts, and I'm sure you agree. Avoiding insurance is part of the reason of why we can provide good health care.
Yes.
And your PCP using insurance is part of the reason you keep being disappointed when you go in for those 5-minute visits, because it's actually insurance handcuffing the provider. We all blame the providers, and there are bad providers, but really it's insurance and big pharma controlling the system and handcuffing the providers.
Yes,
That's why you
100%.
can't get comprehensive labs. That's why you get Synthroid instead of, doing the right things. That's
Yeah.
why you get a statin, and that's why everything is the way it is.
Yeah, no, I completely agree. And that's a conversation I openly have with my patients because some want to understand why. And I flat out tell them that I don't want to be restricted by the governing body that is insurance companies
Yeah.
and the mandates that they put on providers. I worked for, well, no, it was when I was doing my clinical rotations in Florida. And my preceptor at the time, she told me 86% of their patient population had to be vaccinated per the insurance companies. That's not per the AAP or the American Academy of Pediatrics or the CDC. That is per the actual insurance companies, or else they would not, they would kind of get the boot. And
Right.
I'm sorry, anytime that you have that pressure like that, that skews your judgment. It skews your judgment. And I will not allow anything to skew my judgment or not give me the time that I need with a patient, not give me the scope of what the spectrum of what is available for use. You
Yeah.
said it perfectly, how providers are handcuffed. Yes, I have conventional pediatricians who are like, gosh, I wish I could do this, but I can't order a stool test. I can't order these more comprehensive labs because they don't take insurance. The laboratories themselves don't take insurance. And so there are ones out there who are interested, but they are absolutely bound by insurance companies. And I refuse to do that. And once patients hear that, they're like, oh, okay.
Yeah. Sign me up. I'm good.
Yeah. Yeah.
And I think, I see it too with our providers and simply in the conversation around prior authorizations. I
Oh
don't think there's
my
a
gosh.
better example of
Bane of my
bullshit
existence.
in terms of
Yes.
prior authorizations. Because to your point, it's not only I can't do this approach. Sometimes it's I have to do three other approaches that make no sense to your issue and first before they approve it.
And
And
then
that
someone
just kind
behind
of
a desk is
shows you
just
how it's so
deny, deny.
dysfunctional, you know?
It's crazy. And then, right, and it's left to somebody else who's sitting behind a desk just to say, deny, deny, deny. I mean, so many examples there. Everything from my kiddos on the spectrum who need certain therapies to men who are just trying to get HCG, and everybody in between.
Yeah. Yeah. So knowing that most people who come to you do kind of have that expectation, I'm imagining that your intake forms look different than most hospitals and pediatric clinics. I'm assuming the time that they spend with you looks a good bit different. Are they surprised or is that all expected?
So, because we are a cash-based office, we always make that very clear. This is the time that you're getting, this is the cost. I've worked for functional practices where patients got to the front and they're like, holy moly, I was not expecting any of this. And when I opened my own practice, me and my business partner were like, we're always transparency, always honesty, always helping to prioritize for the patient. So the second they call my office, they speak to the new patient coordinator. She then decides, okay, is this a kid or an adult who needs more functional and needs a 1 hour? So all of our functional appointments are 1 hour appointments to begin with, because in that we are digging. I mean, you get, and you know this, I'm sure, but you get so much information if you just listen. If you just open your
Ask the
ear
right questions and listen.
questions and listen, you have so much information, and then I know exactly where to go. So it is an hour intake where we are diving into, let's say it's a kid. We are diving into mom's pregnancy, birth, postpartum, even for her, but
Uh,
also the kid, going into everything. Did mom get the flu shot when she was pregnant? Did she have mercury fillings? Was there any dental work? Like nitty gritty things. And then going into, okay, once baby was born, what interventions were done, what's past medical history, anything recurrent, anything chronic, medications, antibiotics they've been on, and then into all kind of current cognitive, energy, diet, GI, physical, every single system you can imagine. I'm asking hundreds of questions in these intakes to
Yeah.
really get to know the patient. So that's more the functional side. So they do understand and expect, okay, this is 1 hour, this is the cost. When it is a kiddo who's like, hey, I need a pediatric home that's more holistic, that is accepting of what I want to do with my child and
Mhm.
supports, my decision as a parent,
Yeah.
then that is always a 30-minute visit. Always, because we aren't just checking boxes for milestones at those appointments. We still need to know, okay, what's family history? What's parent history? What do we need to help prevent in this child? Because genetics are 30% of the problem, but you have 70% to work with.
Right.
So we need to know those.
Epigenetics. Mhm.
Yeah, exactly. We need to know that 30% so that we can really protect the kid
Yeah.
and give them that unique care. So the shortest our appointments are 30 minutes for more of well. Now, some acute visits can be 15,
Sure.
but hardly. Those
Yeah.
are so rare because
Sure.
we just like to spend time with our patients.
Yeah. I mean, it's almost as if you guys use deductive reasoning and common sense to help people. And it's shocking, you know? It's shocking. And, it's sad to say that, but I love everything you're saying. And to be perfectly honest, it's nice to know that, you said you're in Georgia. There is a brick and mortar pediatric facility not far away that is doing things right. So I love to hear that. And, just to share how aligned we are, we kind of have a similar intake or onboarding process at our clinic. We've, to a degree, trained our administrative staff to pay attention to certain
Mhm.
feedback markers on intake forms, highlight certain red flags, and they're the ones making recommendations of labs to get, what type of consultation to set, who to speak with, on which side of that. Is this strictly HRT, or does this woman have quite a bit of dysfunction before she moves over to HRT,
Right.
So I love that. I love that. That's how we set people up for success, not waste their time, not waste their money, not waste their energy. The three most valuable things that we kind of have right now. So I'm big on that. And I also agree that setting expectations is huge.
Yeah.
Um, taking reversing chronic disease is not cheap. Whether we're talking monetarily or just time and energy, it's an expensive process to reverse chronic disease. And a lot of people understand and appreciate that, but a lot of people are still working it out that, like, wait a minute, I thought it was my right to have insurance cover these things, and now I have to, like, go around that, but I'm still paying for the insurance and stuff. And it sucks.
It does suck. It sucks every which way because
Yeah.
insurance is not cheap either. If you're kind of in the middle ground, insurance is insanely expensive for just middle
Yeah.
America.
Yeah.
And it does get frustrating. And I even catch myself is like, why do I still have insurance? Because none of what I do takes insurance, but it's still that what if. It's that,
Yeah.
well, what if one of my kids goes to the ER? What if one of my kids? And I get that with patients, and we try, there's only so much that you can run through insurance.
Yeah.
Anytime, I mean, even anytime a laboratory takes insurance, we always say we'll submit it to insurance. We never collect money for that. But it can get extremely expensive with all the labs that don't take insurance. And
Yeah.
it is such a scheme. Insurance is such a scheme. Let me tell you a quick side story just to
Please,
show you how insurance is such a scheme.
please.
So we're pregnant with baby number 5. Crazy, I know. But I
Congratulations.
did, thank you. I like to find out the gender. So in doing that, you can do the NIPT test, which is a genetic test, right? For baby, but I really just do it to find out the gender. So I went to LabCorp, even though I could have it drawn. I was getting antsy. I didn't want to go to my office. So I was off on a Friday. I go to LabCorp to get it drawn. Now they ended up not having the tube, but when I was there, they quoted me with my insurance $750. Okay. with my insurance. That's running it through insurance. When I got back to my office, I ran it as self-pay. You know how much they charged me as self-pay?
200.
$250.
Wild.
So you're just making stuff up. Like you're literally just making it up at this point. It's such a game and it's such a scheme, but it does drive me crazy. But to your one thing when you were talking, that is, I think a lot of my patients, because I get that question all the time. If I have patients who are chronically ill who've been suffering for 20 years and they come to me and I'm kind of their last stop, we have a lifetime to unpack. You are a bioaccumulation of information from the moment, even in utero, but from the moment you are born onwards. And so to go and reverse that is costly. But then I think what a lot of my patient population forgets is you can take away that disease or whatever it might be, but then you have to actually work on healing the body and reversing the damage that was done. And that's kind of a secondary journey. And I think I get patients ask me all the time, well, how long, like, when do you think I can be perfectly normal again? How long do you expect? And I'm like, we can't answer that question. I have
Yeah.
guidelines and kind of what the disease is
Yeah.
a parameter, but
Right.
the healing journey
Yeah.
after whatever it is actually gone and eradicated is equally as important,
Yeah.
equally as long, and unfortunately equally as costly. And insurance doesn't give you know what.
Yeah. And there's so much context to that.
Hmm.
We know how much nervous system regulation plays into healing. A lot of things can come up in 2025 that you could have been doing great and something happens,
Hmm.
or a couple things happen.
Hmm.
And maybe you're not regressing, but you're also not progressing. And that's where things take a little bit more time. Adaptations need to happen, pivoting needs to happen. It's very hard to lay that out in a promising style for someone of like, this is exactly how long you need. And something that I remind people is like, to your point, we're talking 30 years of disease and we're talking about unpacking that in 3 to 4 months. This is a crash course into getting healthy. Let's
Hmm.
really have realistic expectations of how many changes are needed, nutrition, lifestyle. Yeah, you're going to be taking a lot of supplements. Hello, we're crash coursing a decade of disease per month, or trying to. Um,
Right.
it's going to take time. And to
Yeah.
your point, even after we've addressed the burdens or the dysfunction, we got to heal. We got to rejuvenate. Mitochondrial needs repair, nervous system repair, immune system repair, metabolic repair.
Mhm.
It's not instant.
That
And
is not,
unfortunately, we're in a very instant gratification society, and that's tough.
yeah, it is tough. I will say the one. And the frustrating part is I think a lot of the patients I get on the functional side with chronically ill adults is that they're at their wits' end. It's
Mm,
the last straw, and they've been on this journey for so long already. And so they've seen, 12 different specialists,
yes,
cardiology, neurology,
you're their last stop.
yes. And so by the time they get to me, it is that expectation of like, this is it, but I'm also now over it and done, and I don't want these symptoms anymore. So now I'm frustrated. And that is a very fine line balancing act as a practitioner. But I do think to what you said kind of earlier on is my own journey really helps in that case because a lot of my patients can look across and they'll say, okay, well, I see you sitting across from me. So, and I know your story and I know what you went through. So I know it's possible. And that gives me hope.
Yeah,
It's that little extra connection and gives me a little bit of a buffer of time to be like, hey, we can get there. We will get there. And I'm so sorry that you've been mismanaged until this point, or
yeah,
things haven't been found, or true root cause has not been brought up to you.
right.
But let me point out all of what has been missed in the
Yeah,
last years of your life. And it is dissecting and unpacking and then strategically moving forward because you get patients who can't tolerate taking vitamin D. You know what I mean? They're so reactive to everything.
right.
And
Yeah,
you
theanine, anything.
anything, you have to finagle, or if they're, MCAS and super high histamine, you have to be able to finagle their system and try to do what you do. And it does take time. And I do understand from that point of view too, because I got to that point where I was like, I did everything. I did all the protocols, I did all the antibiotics, I did all the IVs, I did all the things until I found what actually worked for me. And that is kind of that's where I try to strive to be for my patients.
Yeah.
Okay, this has worked. So what is missing? And then you come in, it does take time and it takes effort and it takes money and yeah, insurance is just it's a scheme
Yeah.
all in
The
all.
one thing I'll say too is, obviously a lot of people come to us not knowing they have disease. You
Yeah.
know, they have IBS, they have Hashimoto's, they have PCOS, these labels for their symptoms, but then we dive in and there's way more that they didn't even know about. So in some instances, this is the first time that they're hearing about this. This is the first time that anyone told them that they've been living in mold for 20 years or that they have Lyme disease from 30 years ago. It's never been brought up. So there's that community of like mind blown, like, should I even believe this? This, does this track and stuff like that? And then there's the other ones who, like you said, they've been through it all. They've already seen five functional specialists. They've already been through the ringer. They've spent $10,000 on treatments. Their trust is limited. Their patience is limited. Everything is limited. But at the same time, as you get deeper and give them new information or new answers, there's a level of validation there. No one likes finding out that they have disease, but validation over 30 years after everyone said that they're crazy and that it's not real, that means something to a lot of people.
Absolutely. And there's two huge things right there that I find with my patients. There's kind of these light bulb moments. One is that there's other explanations. So, for example, you named some good ones, but one of mine, like a huge pain point for me, is anxiety. When they've been diagnosed with general anxiety disorder for years and years and years and years, and aren't aware that that's just a name of a symptom. To me, that's not that should not be a formal diagnosis because why is that anxiety happening, right? And once I explain, hey, your symptoms are, yes, you have anxiety, but where is it coming from? You could be
Yeah.
high histamine. Histamine duals as an excitatory neurotransmitter. Now we have more OCD, tics, anxiety, insomnia. Is that your problem? Are there certain bacteria that are replicating within the central nervous system that are altering your neurotransmitters and the receptors, and that's
Yeah.
causing anxiety?
Yes.
Is it cortisol? Everyone loves cortisol. And for me, cortisol is still, it's a hormone, so it's off for a reason. But could cortisol be high and that's what's causing your anxiety? Okay, then why is the cortisol high? Once you start explaining things like that, they're like, oh, this makes sense. And you just connect the puzzle pieces together and bring it all back. I tell patients this all the time. You just have to dumb the body down. We
Yeah.
get all these fancy names and all these fancy
Yes.
diagnoses, but you have to dumb the body down. And I think that is really, really helpful for patients to kind of connect to and understand. And something else is we do, like right out the gate, I do run quite a bit of labs because, and I put them in order of priority, what helps me understand that patient and their body, because it's very counterintuitive for me to know a very specific piece of information if I don't know the rest of your body and how to treat.
Context. Yeah.
And so when they get all that back and they look at it, it can, we're going through it and explaining it, it can be very overwhelming. But something I always tell my patients is that there's always something that can be done. I will never look at an ANA that's positive and be like, oh, yep, well, I agree with rheumatology. It looks like you have lupus. No,
Yeah.
I'll say, okay,
Immunosuppressants.
right, exactly. I will say, no, I am looking at as a data point and saying, okay, your immune system is triggered right now, but why? And then I run the labs behind that to say, here is your why, and this is what we're going to do about it. And that then helps to kind of take that ease off the patient and
Agreed.
understanding, okay, yes, it's a lot of information, but I know something can be done about it, and I can link it back to how I'm feeling. And just spending that time to explain things to patients, I mean, it means the world to them. And you can't
Totally.
get that in 5 minutes at a PCP, at a PCP office.
Never. Yeah,
Never.
and then honestly, I mean, we both know that treatments can go a lot of different ways. Some people feel great right off the rip. Some people feel bad right off the rip. And there's a lot of context there. But for the most part, nothing's more motivating than progress. And if you can just show them a little bit, they will keep going.
Mhm.
Just small wins week to week, and they're like, she's right, this can be fixed. And
Mhm.
it just changes everything for them.
Yeah, it does. And that's why I write everything down. If you saw my charting, Like I write everything down that the patient says and I tell them that. If they're like, hey, my left pinky toe burns all the time or feels like there's one ant crawling on it, I write that because a month down the line, I want to be able to ask you that exact question and for you to sit back and be like, oh, wait, no, that's not happening anymore.
Yeah.
Sometimes my patients have so many symptoms, and your brain can't focus on 102 symptoms at the same time. So it hyper focuses kind of here and there, intermittently through different symptoms.
Yeah.
But I'll remind them and be like, hey, how is that doing? And they're like, oh, wait, that's gone. Oh, wait, that's gone. Oh, that's gone too. But I still have this. But it's that realization
Yeah.
of holy moly, like I
Things
was
are changing.
told. Yeah, I was told this couldn't be done. Or when I see, like you mentioned Hashimoto's, when we see thyroid antibodies start to go down or an ANA turn off, they're
Right.
like, oh, my, endocrinologist said that could never happen. And I'm like, well, of
Of course they did.
course they did.
Yeah. Yeah.
But it's validation in how they feel, but then
Yeah.
also the numbers improving and just those data points improving too.
Yeah.
That is wildly beneficial. And that goes for adults and kids. When parents see children who are more energetic or they're not reliant on Miralax or they're not, reliant on something for a basic pathophysiological function, they understand and know that things are getting better. And that's a really cool place to be as a provider.
Totally. I gotta say, I've spoken with a lot of people and a lot of there's a lot of great functional practitioners out there, but I'll be honest with you, it's rare that I speak with someone who has a busy practice who still focuses so much on the breadcrumb trail and the deductive reasoning pieces and connecting all the dots for patients. And I don't know if that's a busyness aspect. I don't know if it's still the Western medicine training piece where that you've kind of evolved from. And I'm not speaking poorly about them. I'm just highlighting that I don't hear what you're saying very often, and people need to understand like this is a big deal. Like the level of care you're giving is completely different than 98% of what is happening in America.
Yeah, I thank you for that. I appreciate it. It's something I constantly remind myself of. And I think there's two big aspects to that is one, there was so much missed in my own health because questions were not asked. I mean, I look back at my own health history as a kid and I'm like, this stuff is not new. Yes, Lyme disease came on and I was diagnosed at 27, and I was provoked at 21 post an MMR vaccine. So that's when I
Wow.
started to get sick. But looking at my history as a child, it wasn't new. I can guarantee that I was exposed way before that. And so I take that very personally, where I do not want to miss anything. And so you keep asking why, you keep asking why, and the little things are what will tell me that something's being missed, and then I need to swerve. I think I've worked for one specific, very well-known functional medicine practice where ego was a big thing. And I promise you, if I'm wrong, I will admit it. If I don't know, I will go research it. Where, because I've seen how ego can take over and we get so hyper fixated on this is your problem, this is why, and this is how you fix it. And that's also how you miss things. So I refuse to go down that route. And I think if you start missing the small details, you start generalizing your patients and just trouble follows because then you're not providing unique care to each and every individual when our genetics are different. Our methylation cycles are different, our
Okay.
exposures are different, our environments are different. So
Yeah.
I try to treat every single person, even if I have kind of generalized protocols in my head,
Right.
every single person is new to me.
Sure.
Everything doing is unique to you. And I train the nurse practitioners under me for a year before I let them fly their little wings, uh,
Yeah.
so that it's up
Quality
to
control.
that standard. And I trust them fully. They're brilliant and they have their own brains, not to say that they don't.
Of course.
But I also don't water down our practice
Right.
because I would rather have quality of care.
Yeah.
Uh,
I think there's always going to be a need of standardized practices because that's controlling quality of care. At the same time, making sure everyone is capable of critical thinking. And I think there's levels of critical thinking and inquisitiveness, and that's probably personality traits. You can be a great doctor who reads books very easily and passes tests very easily, but maybe you're not inquisitive by nature. And that's only going to bring you so far. You, especially in functional medicine, you need to like always be inquisitive because the science is always changing and evolving, and we're always learning new things. And that's why I love connecting with others because it's like, oh, I just got a new gem today. I just learned something new from that. Or I can, run it if I get a new issue now, I have someone new to run it by. So I love connecting with people like you who share that kind of inquisitive mind state.
Yeah, I do too, because you learn a lot. And that's also part of why I was running a podcast for the last couple of years and took a little break because I have way too many children at this point. But I love these conversations because I learn just as much from other people, providers,
Yeah.
as I do myself, but also patients. You can learn a lot from patients. Patients, and I will go to my grave with this. Every single patient that I have, they know their body better than I do. They know what is triggering them versus a piece of paper. A very just layman's term example is food. You can do all the food sensitivity and allergy testing you want, but we all know that there's inflammatory markers and complement markers and IgG and IgA and IgE and all these different immune markers that can be, excuse my French, pissed off when you eat a food. So if you just test the wrong one, it can look normal. So I always bring that back to the patient and say, okay, how do you feel? You can feel if certain things are happening or not.
Yeah.
And I always want patients leaving me understanding that they are the captain of their ship, that I trust what they're saying, that I believe what they're saying. And I'm here just to help guide that and be inquisitive and ask the right questions and do the right labs and put them on the right protocols. But you learn a lot from your patients when you just sit back and listen
Yeah.
and honor them and respect them.
Yeah. Well, like you said, most of them know that something's wrong and have some ideas of what might be going on. And sometimes it is like an open canvas where you're just telling them everything that they've never heard before. But most of the time, it's simply just connecting their dots. They have the dots. It's connecting them for them and saying, well, this is why. And this that happened 5 years ago is exactly why this happened.
Mhm.
And it's explaining the bodily adaptations. I
Right.
think that's what most people miss is the fact that your body is reacting to things constantly, and that's most of the explanations. It's cause and effect.
Right. And it's also validating, you're completely correct in that. It's also validating certain things that they view as symptoms that society views as normal.
Normal.
Very
Yeah.
easy for those PMS-like symptoms. Oh, well, all my friends in high school, they all stay home for the first day of their period, or they all get really bad clots and, bad cramping before, and I have that too. Okay, well, that's not normal. It might be
Right.
common, but it is not normal. That's screaming hormone dysfunction, ma'am.
Right.
And so just kind of validating that side and being like, oh wait, okay, this isn't normal. Oh, my body can be acting differently. Oh, my body does start acting differently. Oh, this is what normal feels like.
Right.
Is a very cool point to reach too.
Yeah, absolutely. Um, I had some questions planned for you.
I know, I feel like we derailed from all your
I
questions.
know. Well, it's a great conversation. I mean, we connected so well on our philosophies and ideologies. Um, One thing that I really want to talk about today, that I'm sure we'll talk a lot about, is what I mentioned to you earlier. Most people who get involved in functional medicine see that the community leans to be more female than male. More women are dealing with dysfunction than men, or at least more women are symptomatic to dysfunction than men. And obviously there's a couple of different reasons for that. Men avoid doctors, men just kind of brush off symptoms. But I do truly think that men experience less symptoms than women, just because of how we're wired, how our endocrine systems work, how everything works, men's resiliency to stress being different. But so that being said, bigger female population of dysregulated people. And with that, there's a lot of conversations around children. And I feel that, in general, women's health is a disregarded topic to a degree in conventional medicine. I feel like they take a lot of men's research and just like translate that right over to women. No appreciation of difference in physiologies or anything. It's just like that. And then with that, the entire concept around fertility is really just like making a baby, and that's the end of the discussion. And there's not much else to it. How do
Yeah.
you feel about that?
Oh my gosh, so much to say. Okay, first, quick story. I completely agree with what you said with men versus women. And a great story is me and my husband. When I was super sick, I mean, bedridden, before I did the treatment, we use SOT for Lyme, but before I got an SOT, that was what really helped me. I did everything else, right? Still very, very sick. When I went to go get an SOT, the provider was like, hey, we should test your husband because we know that this can be passed back and forth, just in case. I was like, okay, whatever. His labs come back. This man is CDC positive for Lyme disease. Now, my husband at the time, professional athlete, sleeps 4 or 5 hours a night, and that works perfectly for him. Built like an ox, healthy, no fatigue, no symptoms. And I'm like, you've got to be kidding me. Here
Right,
I am dying
right,
every single day,
right.
chronically ill, every symptom that you can imagine. And
Right.
you're just walking around CDC
Yeah.
positive
Just
Lyme disease,
chilling,
just chilling, just
thriving.
no symptoms. Right. Like it is a perfect example of what you just said because yes, y'all are wired differently. And I see it all
Yeah.
the time in practice. Now, with women, so another thing that came to mind is lab reference ranges. I have a huge
Yeah.
problem with reference ranges in general, obviously, because a lot of people don't know that even just LabCorp cross reference ranges, they're based on the average American. Okay, the average American, 70% have chronic disease. So we
Right.
are
Obese and
basing
diseased.
yeah, we are basing that on disease. So my personal reference ranges are that small, but they do not change for women versus men. And so that's a huge hiccup too when you say, okay, you're normal. Are you looking at this as normal for an optimal female at this age? Or are you just looking at it because it fits within your LabCorp reference range? So I have a huge issue there because I think we miss a lot of what can be prevented if we just looked with
Yeah.
a little bit bigger of a magnifying glass
Yeah.
to
Well,
look at
zoom
stuff.
in.
Yeah, zoom in, please. Um, but then I also think with pregnancy, a lot of that falls through the cracks. With pregnancy, I mean, good examples are if my patient population, if women become pregnant, most conventional OBGYNs are not seeing them until about 8 weeks. Well, how many women miscarry before they even get to that first appointment? And sometimes it's 8 to 10 weeks. So as soon as they find out, I'm running their progesterone, their thyroid panels, their vitamin D, their B12, their folate, their ferritin, their iron. I'm running their micronutrients right then. And how many women do I come back where their progesterone is a 9, a 10,
Yeah.
where sustainable in first trimester, minimum 12?
Yeah.
Would have lost that baby by the time you get to the OBGYN. So I think women's health, yes, is completely mismanaged. And there's no kind of starting point to it because it's
Yeah.
mismanaged. I mean, from the time health is mismanaged in general,
In
but I
general.
think
Yeah.
especially for pregnant women, it is exceptionally mismanaged.
Well, I know I'm trying to not go on soapboxes, and I think you are too, because I know
We're holding back. I know.
we could be on this for 5 hours. But I honestly feel like one of the biggest lies is that women are having informed consent, but you're not informed. You're misinformed about everything. So you're not actually making educated choices. You're making uneducated choices, but it's not your fault. It's society, it's big pharma, it's everything being thrown at you is basically wrong. And so you just go about your day with these assumptions. And I think that's important for women to know that like everything they've been told is probably wrong or 98% at least is misconceived in some regard. Um, you know, I think there's a growing appreciation of nutrition and pregnancy, but there's no appreciation of stress and pregnancy and
Mhm.
how stress could impact fertility in terms of contraception and successful 9 months of carrying that baby, both impacted there. And I explain that to women all the time. It's not just about having a baby or getting pregnant. It's about that success for those 9 months. And I mean, I don't know if you've seen this through your practice. It sounds like you have, but like estrogen dominance, low progesterone is a huge driver of that miscarriage risk.
Mhm. Yeah.
And they don't even know that they were estrogen dominant for 10 years to begin with, that they've never had healthy progesterone ever, you know?
Yeah, because they were just slapped on birth control. So they don't have a chance to
Since
know.
15. Yeah.
Yes.
Because they had acne, like,
Gosh, it's the same with women who suffer from fibroids and then have a
yeah,
hysterectomy and are told that they can never have babies. And then I do their labs, and even status post hysterectomy, they still are estrogen dominant. And the questions that you ask there, okay, are you overproducing? Are you not digesting? And the estrobolome within the GI tract, are you not breaking it down? Where is this hiccup occurring that you are increasing in that estrogen? Is it the metabolites? Is it the methylation? What is it that's going on? And it's almost, I don't, it's almost disheartening when you find that problem for them when they're
yeah,
45 and past, past hysterectomy and past childbearing ages, because I can't help every time that happens. What if? What
yeah,
if this someone else came along and gave them this information 15 years ago? So
it
it
sucks.
it does, and it's so much bigger than baby making because you have to also think that everything in your life, like we've said, is a bioaccumulation. So women, you're born with the eggs that you got. If you
Right.
start damaging them from an early age with everything we're exposed to, endocrine disrupting chemicals, whatever it is, harsh, chemicals and toxins and medications, birth control, side tangent. I'm not going on a soapbox, but side tangent is none of my patients understand the importance of ovulation is
Mm,
that we are meant to ovulate. We are meant to ovulate for at least 35 years of our life. Why? Because that is protective. It's protective for our hormones. It's protective for certain cancers. It's
yeah.
protective for Alzheimer's, dementia, neurocognitive disorders, in terms of osteoporosis and osteopenia. But when a provider slaps birth control on a kid at 16 and now all of a sudden they're 30 and want to start having babies, they don't know that. They also don't know that it suppresses their testosterone or depletes their micronutrients. So the patient,
Or
oh,
it could
like,
be the cause of their anxiety, metabolic dysfunction, weight loss resistance,
yes,
you
all the
name
things.
it.
So to your point with informed consent, no, us women are not. I mean, I think informed consent is an issue all across the board, but in this situation, no, I can't tell you any single woman that's put on birth control that understands the risks, understands what it's suppressing, understand what it's reducing in you fully, and then says, yes, I still want this. It's slapped on for everything, for PCOS, for endometriosis, for acne, for hormonal migraines, not just for preventing pregnancy.
Well, I
So
got to be honest with you, and I don't mean to say this the wrong way. Again, I'm never trashing providers, but in my experience, most providers don't know the mechanism of action of birth control.
100%.
So if they don't know, how can we expect their patients to know?
It goes down to the education of the providers.
Yeah.
Absolutely.
Yeah,
Yeah.
and that goes back to, Big Pharma's stronghold over med school and what you're learning in pharmacology and stuff. And it's just like Band-Aids, Band-Aids, Band-Aids.
Yeah. Absolutely. I completely agree. And I think it's a shame because it's a shame because it's put society in a place where we become, I think it's better now, but a couple years ago, very just lazy and compliant. And
Sure.
people
Yeah.
just listen and do what they're told. And
Sure.
I never want my patients to do that. I always say, hey, this is my guidance. This is what I'm suggesting, but you need to research these things. You
Yeah.
need to look them up. We need to have open conversations so you can make that educated decision.
Yeah.
And I try to remain very neutral because even though I have my own personal opinions about everything and
Yeah.
what I do with my own kids, I try to stay neutral and provide all evidence so that that patient can make an actual
Decision themselves.
informed decision. And some honestly just look at me and they're like, "Can you tell me what you do? Like, what do you do with your kids?" And I'll tell them, like, I'm
Hey, I mean, they're trusting their professional, so no problem with that.
yeah.
No problem with that. Um, so with that, let's talk about, so we brought up how, obviously women aren't too informed and that there needs to be discussions, better discussions around the entire pregnancy success from contraception to delivery. And how many different aspects can play into that. Um, in your practice, is it common at all to try to, and obviously this wouldn't be on you, but is there any type of conversation ever where women are giving you a big heads up of like, hey, in 6 months, I might want to start creating a family. And you like have a strategy in place of like, great, let's prime you.
Yeah. Absolutely. I actually just had this patient the other day. She has two, but she wants them. And she said, hey, February, I want to start trying.
Okay.
I love this patient because it gives us an opportunity to set mom up for success, but also baby up for success.
Yes.
Everything that mom is exposed to, every choice that mom makes in pregnancy impacts baby's development and then further health and development later in life. So I love that patient. And yes, there are, if let's say I'm on a time crunch, some of these patients are like, what can I do in the next 4 days I'm like, girlfriend,
Relax.
give me more time, please. So it really depends on their timeline,
Yeah.
but I am looking at the essentials. I always start down at the nitty-gritty. I want to see gut health, immune function, metabolic health, mitochondrial health. Then I spread wings outward and see, okay, what have you been exposed to? What viruses, bacteria, what's chilling in the immune system? What's a little activated in the immune system? Just normal things that you should be exposed to that I just want to know how they're acting right now. Then, of course, we broaden that and go into more of the hormonal realm and the micronutrient deficiencies and things like that. But there's a lot that you can do safely. So, with those women, once I get those labs back, I tend to start them on strategic protocols that look very different than if I have a patient with mold toxicity and I need to like, just use everything strategically, but it's a heavier duty protocol.
Yeah.
I want to make sure to use things that are safe while actively trying to conceive. And if they do become pregnant, I know exactly if there's some things that need to be stopped, what I can swap it for, or just become a little more gentle. But if we just focus on the bare bones of our health, which to me is gut, immune, metabolic, and kind of mitochondrial, just that layer, we could really help women, set women up for success in their
Dude.
pregnancy and set the
Can I
kid.
pause you for 1 second? Because everything you're saying is huge. And I think an important piece that female followers listening to this need to understand is that it's not just your actions during pregnancy. That's big. But I don't think people understand that your entire life prior, the 20 years, the 30 years prior, are so important. And to that point, infections and internal burdens can actually be passed mother to child. And so when we're talking about these things, you could literally set your child up for failure in autoimmune, autism, Down syndrome, all these neurocognitive issues. This coming from somewhere. And I know we're going to get to this, but the conversation around vaccines in children, personally, I think it's a combination or a coalition of detriments hitting the child at once. And that's why we're not seeing across the board. We're seeing unhealthy children combined with vaccines, leading to lots of problems. But a healthy child might be able to handle that burden okay. Do you agree?
I completely agree. Yes. And I don't know if you want to come back to that or talk about it right now, but that I completely agree with you because for me, when I first worked in functional medicine, I worked with a patient population that was majority of kids on the spectrum. And it used to be
My
10, 15.
nephew's on the spectrum.
Okay. It used to be that we were seeing children from pediatric standpoint who were born delayed, right? Who showed that delay from the get-go. I cannot tell you the last time I saw a child on the spectrum who was born delayed. Most of the time, and that's a bold statement, but most of the time, I see children who are developing neurotypically who then have a regression at some point.
Yes.
So that to me, looking at their entire history, usually it makes a lot of sense. We have a baby, we have a mom with autoimmune conditions who's really high histamine, who then gives birth, and the baby gets an abscess, at 1 month old and has to have systemic antibiotics with the
Yes.
INT. And then they have 6 ear infections with antibiotics by the time they're one. And then they get their 12-month set of vaccines. And now all of a sudden they've gone from being verbal and babbling to having nothing.
Correct.
That to me is exactly what you said. It's the predisposition, it's an unhealthy kid, it's the degrading of a healthy child in the first year of life. And
Yeah.
that vaccine was kind of just the cherry on top.
Bingo.
Yeah, I
And
can.
I want to pin this and come back because you were making some great points. The last thing I'll say here to our listeners that I talk about all the time is very rarely is it a singular individual burden. It's an accumulatory effect. Once our body's stress buckets overflow, that's disease and dysfunction. And so people kind of need to understand that this is an accumulation. It's never one thing.
No, absolutely
There's
right.
things building up in there,
Right.
even for a 2 month old.
Right. Yeah, absolutely. And kind of back what we were saying before is I think conventional minded says, hey, 3 months before conception kind of sets your baby's blueprint. No, your entire life sets your baby's blueprint. But it is worthy if you know you're going to try to actively start trying to conceive, then at least 6 months. I would love the year before, but at least 6 months because you are already setting your baby's genes. You're already setting your baby's immune system and gut health. And so, if we start that process and help your body gently detoxify before conception, or balance inflammatory markers, or help nutrient repletion, or whatever it might be, then you are literally optimizing your future child.
Yeah.
Yourself also, but your future
Yourself
child.
also. Yeah.
Yeah, yeah. I'm like, mom's important too, because we get
Yeah.
forgotten about, that's for sure. But it's a chance, especially as you mentioned, epigenetics. Epigenetics tells us that gene expression is influenced by environment. And so if we already know we have certain genes that we're up against because we're all genetic mutants and genetic SNPs, then we can optimize that 70%.
Right.
And before pregnancy is not the time, before pregnancy is the time to do it. During pregnancy is not the time to start doing it. Now, would I rather have a woman start doing it if they haven't during pregnancy?
Cool.
Absolutely. But we are not taught, oh, hey, hey, take care of ourselves for the future to become pregnant for the future of your children. Where no one tells you that.
Do you think that the rise in IVF is a result of the deficiencies of what we're talking about, or do you think that IVF has now turned into a reason for the deficiency? Because now big pharma is just making that money, and so they don't want women to be healthier. They don't, want to prime fertility ahead of time. I hate to make it sound like very pessimistic, but it's sometimes true.
I think fertility is under attack.
Okay,
I think
well put.
period. I think fertility is under attack. And you can see this in women's hormones and you can see it in men. You take men's testosterone, as you know, and that has greatly declined in the past 50 years. You see men's sperm count, motility, the health of the sperm decline in the past 50 years. And you compare us to other countries, and you can clearly see that there are environmental factors impacting that.
Sure.
So I think that I think conventional medicine, big pharma is all very predictable. You
Yeah.
create a problem, you create the solution. So we are hit from the second that we're born with things that damage our hormones, that damage our fertility, that damage our egg and our sperm counts and the health and the quality of those things. By the time then you go to try to have a baby, oh wow, you can't. So here I have the solution for you. I mean, it's a $1 billion industry. So I do think it is very just what happens. They create a problem, they create a solution. And I think many people who go through IVF don't try or maybe don't know that there's an alternate
They
route,
just don't know.
yeah, they just don't know that there's other things that can be done to
Yeah.
try before,
Yeah.
to optimize your health, even
Right.
getting into peptides and you know, we don't have to go down that rabbit hole because that will send us on a whole nother tangent. But even getting peptides on board with you optimizing your health. And I can't tell you how many women were told that they couldn't have babies before. And hey, now they're pregnant
Now
because
they're
we
pregnant. Yeah.
optimized your health and
Yeah.
you pull little peptides and you're good to go.
Right.
So I think, yeah, I think it's been created. I think it's a problem that has been created that surrounds, I mean, it's a lot environmental. I do think genetics play a part in it,
Yeah.
but again, that's a small part. Genetics don't have to activate. We make
Right.
them activate because of
Make
the
them make it. Yeah.
everything surrounding it. Yeah.
Yeah. Well, and I think so. It's too, I mean, we both know IVF is not cheap. It's an incredibly expensive thing. And for the most part, insurance typically is not always covering it. So to that same point, again, it's a lack of awareness. But if you just took that same money and fast forwarded 6 months earlier and put that towards functional medicine, you guys are set.
Yeah,
You
I
know?
think it's absolutely worth a try because there's also, and I don't want to misquote this, but I did read a study recently, and I can't remember the percentage, but it was a study basically on IVF babies and then later in adulthood, chronic illness and inflammatory responses. And there is an increased risk there.
Shocker.
Right. And are
But
you
it's not the IVF's fault.
so, just for the sake of your health in general, yes, I always wish that women and men too were given the chance
Yeah,
to optimize their health before going down an IVF route,
yeah,
because chances are there's so much that can be done before you choose to do that. And it's okay if you do that. And I have so many patients, beautiful little boys and girls who are born via
of
IVF. But it is disheartening when you know that things could have been done for the
yeah.
parents' health to help support their hormones.
So let's get back to your process. A patient comes in, they give you good amount of time, their head is on straight, and they just want to prime themselves for pregnancy. Let's kind of walk through that.
Okay,
Your
so
ideal patient.
my ideal patient, I would have, in terms of pregnancy specifically, I would have 6 months to a year before you actively want to try to conceive. The labs there don't really change. I still want to see basic mitochondrial health, methylation, detoxification markers. I want to see toxic burden. I want to see your viral and bacterial load. I want to see your basic pathophysiology. How are you operating on a day-to-day basis? Your immune function, yes, normal things like your thyroid and your liver function, all of that. But to me, I'm looking at it from a much smaller lens. So I run all that. And then we start getting on protocols. Okay, if I have a year, then hey, I have some time where if I do find something that needs a little bit heavier of a treatment, I have a couple months to get that done and I'll get that done. And then after that, it's you have to change from kind of pressure and more of that kind of harsher protocol to a more supportive protocol when you're dealing with someone who's trying to conceive or gearing towards that direction. It is not a time to go on a crazy parasite cleanse, a week before you try to actively conceive. So
Can you give a little insight into why?
because those toxins can go through the umbilical cord into the placenta. So if you are, and it's also depending on your detoxification pathways. If you are detoxing too quickly and not excreting it out quick enough, now it's just kind of floating around.
Recirculating. Yeah.
Yeah. And so we can absolutely see those toxins cross the placenta and hold in there.
Mm.
So I'm very cautious, especially with things like heavy metals and mold kind of right before we're trying to conceive. Now, it's also not a reason if you know those things are present to not try to very strategically and softly help mom detox them out. You just do not want to increase the burden on the child and have that cross the placenta. So, and just oxidative stress reasons. Again, if mom's a bad detoxer, I don't want to increase oxidative stress right before this point in time. So
So
then you
it's
put
not
your,
necessarily like the antimicrobials or antivirals themselves. It's the result of the eradication and detoxification processes.
yeah, there are definitely some. Now, once a woman becomes pregnant, that answer changes because there
Yeah,
definitely are some antimicrobials that you cannot take
sure.
and things. Wormwood, I don't recommend in pregnancy. So there are natural antimicrobials and antiparasitics in pregnancy you cannot take. But yeah, you just don't, especially the month or two before, you just don't want to increase that toxic burden for
Mhm.
the sake of baby potentially in the next month. So I try to transition them to kind of a softer, supportive, okay, we know that you, or let's say they even get pregnant. We know that you have this thing, whatever this thing is. Okay, how can I support this without directly attacking it? So a good example is candida. If I have a patient who has systemic candida, okay, I do, traditionally we need binding agents, we need antioxidants. I'll use some natural antifungals, but then I do compound and bring in the big guns of compounded nystatin or fluconazole or Sporanox, whatever it might be. Not pregnant is not a time for that, but I can give you a spore-based probiotic. I can give you a little activated charcoal. I can give you some caprylic acid that just helps to, it might not eradicate it while you're pregnant, but
Brings the
it
threshold down.
it brings the threshold down, which then brings the threshold down for baby.
Sure.
So we kind of transition into a softer protocol if things are still going on at that point. Now, my utopia would be that once women actually do become pregnant, I can just support them, that I don't have these lingering viruses or bacterial, fungal things, whatever might be going on that I need to actively treat, but
Mhm.
that I can just be supportive. And that's where I really feel conventional OBGYNs totally miss the mark. It's like, are you taking your prenatal?
Right, right.
Great,
What
that's
a
it.
joke.
Okay, okay, good. Where I'm like, okay, sure, let's take our prenatal, but what are we taking? Is it carbon bonded? Is it,
Uh,
bioactive? Is it right for you?
uh,
How much vitamin D are you taking?
right.
And are you
The
checking?
bullet, you know?
Right. And you can look, I mean, some patients are deficient in vitamin D in the serum, but are holding it in the liver. So checking the right form of vitamin D also matters.
Yeah, yeah,
And so then your gut. I always support women's gut health in pregnancy. There are certain probiotics I like to rotate through, depending if they can handle them, to help reduce the chances of getting group B strep. Um, so I always want something with Lactobacillus rhamnosus on board, and you can actually, side note, insert that vaginally if you are diagnosed with group B strep, and then ask for a retest 10 days later if you
yeah,
have time. And oftentimes women will become negative, but gut health is big. So
yeah.
are they permeable? Do I need a little bit more of kind of a gut support on board outside of probiotic, immunoglobulins, glutamate, whatever it might be? And then I do like to support detox pathways.
Sure.
If a woman is healthy at this point, it can be simply rotating through N-acetylcysteine, liposomal glutathione, and milk thistle. Just one-off ingredients, so it's
Yeah.
uncomplicated, and kind of rotating monthly through that. So gut detox, and then obviously our micronutrients with making sure extra vitamin D and enough omegas in the right forms are kind of
Yeah.
my very minimal baseline. Everything else outside of that is what's this woman's history? Have they had previous pregnancies where they have had certain things going on, preeclampsia, glucose issues, cholestasis? And then, we start to turn in terms of supplementation based on those unique properties.
Fascinating. Do you run into situations, two situations? Do you run into situations where, a woman comes to you, obviously not really giving you that adequate time, and you're concerned about the level of burdens in their body actually directly impacting the ability to get pregnant? And if so, is that a conversation you have with them where you think you're kind of trying to change their expectations of timelines, or do you change your expectations of approach? Both?
Yeah, I changed my expectations. So
Yeah,
I am.
interesting.
Yeah, no, it's a great question. I actually love this question. So as a Christian, I firmly believe that if God if it's intended for you to have a child in that moment, you will get pregnant. So it is my job as the provider to work around that. So I actually have patients. I just had this one last week too, where I would say a month ago, she came up for her first follow-up. And she did I mean, she's chronically ill, very sick, all these functional labs. And then we had our follow-up appointment last week, and she's like, hey, I might actually be pregnant. And I said, okay, well, if you might actually be pregnant, then I'm not going to have you spend money on supplements and things right now. Tell me if you're actually pregnant in the next couple of days, and we will reconfigure. Turns out she's pregnant. So I went back, and knowing all of that information that she has going on, it doesn't scare me. It just shifts my perspective. Okay, what do we have to do now to help protect her in pregnancy, to help protect baby in pregnancy? And I'm very transparent with my patients. I say, hey, our expectation here is that we are as supportive as possible, is that we help you have the best pregnancy possible and protect your baby. There are certain things that won't be eradicated in pregnancy, and I will absolutely make sure to keep my eye on you postpartum because that's when certain things can rear their ugly head if they're not treated. But we're going to manage those right now. There's other things that I will absolutely treat because I know they can cross the placenta and eventually impact baby's health. So those things we're going to focus on and kind of keep the other things managed. So I run into that situation where I change my expectations, but then I also help the patient understand, hey, this is my thought process and this is what we're going to do. The other side of
Knowing
it,
that there's probably going to be some back end stuff for the child and the mother.
and the mother, yeah, postpartum when they're ready. But also knowing that there are stuff that we can take care of in pregnancy safely.
Mhm.
The other side of it is, yes, if you dig deep enough, you're going to find issues with most people. So it is rare that people do these type of labs and they're picture perfect and I have
Perfect.
nothing to say,
Yeah, true.
right?
There.
Um, but in that case, it is rare because I'm so confident and comfortable in swerving if women become pregnant because that example that I just gave you happens to me all the time where I
Yeah.
run these labs, I start them on things, and then a month later, they're like, oh, I'm pregnant. And so I've had to learn how to swerve in that instance. I think that's happened to me enough where I'm confident that there's not much that I would actually tell a woman, hey, I would highly advise you to wait. Because I also trust their body and I trust that God will bring this child when they're designed to have it. But then I trust myself in knowing that whatever is going on, I can help accommodate that patient in the meantime. Now, would it make my life a lot easier if they waited? Yes. But there's very rare instances where I would make that decision for them.
I gotta say, as you can tell, I was a little surprised, but I really respect your kind of your boundary there of that you're going to adapt your process for them. And I also appreciate that adaptability because, to your point, you see tons of people every day. You're a busy person, you're in demand, and I just know that because of your practice, yet you're still willing to adapt. You're choosing the harder road that you could have this easier road and say, hey, look, I'm the specialist. You got to listen to me. It's my practice, and I got 100 people waiting. But instead, you're like, actually, I'm going to make this 10 times harder on myself and compromise and meet this woman where she is and help her.
Yeah.
So hats off to you. That's very respectable.
Thank you. Yeah, I appreciate it. It's funny because yes, I always, and I say the same thing to my patients, and then it's me charting until 6:30 at night, being like, what? But I will take that. I will take that
Mhm.
because I know I can deal with that. And it's not, yeah, I never feel inclined to say, no, you have to wait or kind of play that card. Because I firmly believe that at any point in life, at any stage in life, pregnant or not, breastfeeding or not, that something can always be done to optimize that person's health. And if you don't know, you just have to figure out how to do that. So, yeah, I think it's me who has to change in that moment.
Again, very, very respectable. And that just goes to show that you're reflective in yourself and to acknowledge that and not take the easy road. So here's a question. Is there Is there any type of internal burden or severity of disease where that wouldn't be the case, where you would say like, "Hey, I think we need to treat this first," or is it truly just, in your opinion, most of the time or almost all the time, bringing down thresholds, not treating completely prior to pregnancy,
So, I
like
think
Lyme, for example?
yeah, so Lyme, I'm comfortable doing SOT in pregnancy. So that is something because it can cross the placenta. Now, let's say this is a conversation I'll have with my Lyme patients is if they are just thinking about it and they're like, hey, I'm thinking about it, maybe early next spring we would start trying. And that's open for conversation where they're at in their protocol or if Lyme has been cleared or not already. I will be honest, I'll say, hey, if you want to make sure you do not go into a pregnancy having active Lyme disease, then this is kind of the timeline that I would suggest. So yes, there are definitely things that if we know cross the placenta and can, impact baby, that I will suggest a timeline based on, but I always read the patient first. Some
Yeah.
patients are like, I'm going to start in January. And I said, all right, let's get her done. Like let's
Yeah.
figure and other patients are looking to me for, okay, what
Right.
would you suggest? And then I will absolutely offer that because in a perfect world, I would have time to eradicate those things and get them gone. So it's not even an issue during pregnancy.
Right.
I think the other time more globally is just the patient's symptoms.
Mm.
If I have a patient who has extreme symptoms with extreme brain fog and fatigue and joint pain, and they've had a previous pregnancy where symptoms flared, hey girl, let's slow down a little bit because I have to prioritize you as my patient and
Mm.
your ability to withstand another pregnancy. Now, if that same patient felt amazing in
Yeah.
their pregnancy, because the body can become extremely protective in pregnancy and autoimmune conditions can, decline
Fix themselves, you know.
fix themselves, right? Then that's another conversation. But I think, yeah, two instances largely in my patient population is one, how is that patient's actual symptoms? Are they debilitating? Is this going to put the patient at a disadvantage in their day-to-day life and their quality of life, where now you're dealing with the chronic symptoms and the mental health on top of that because you're so, just exhausted and miserable. Um, or are there certain infections that are rampant right now and you're looking to me for my advice? Then I'm going to choose, hey, if we have time, if you're thinking about it and we have time, let's get these guys gone first.
Yeah.
Yeah.
I have so many questions and comments because, again, functional pediatrics is just not something commonly talked about. So, um, this is just so awesome. I wish we could go all day. Um, okay, question for you, from something we just said. Um, Can you brought something up and I've witnessed it a few times, but I would love your expert opinion on it. So the idea of like things resolving during pregnancy, because is this coming from the body's resiliency and just rejuvenation while it's pregnant? Can you kind of go down, explain a bit of that for me?
I do. I find, can I put the exact science on it? No,
Please.
probably.
Yeah, please.
I do find it is absolutely the resiliency. I think the body is meant and designed to protect itself in certain situations in life, and pregnancy is one of them. So when certain hormones change, when your immune system is shifting, even you're passing, between the placenta information back and forth. So some of that's actually that growing fetus and the stem cells that you're being actively exposed to that are exceptionally healing for patients. But I do think it comes down to the resiliency of women in that moment and the body going into rest and preservation mode for the sake of building the baby. And the baby does take nutrients from you. It does, kind of suck from you in that sense. But it absolutely is a resiliency and preservation. And I think that changes then your immune structure and the autoimmunity that's occurring. It's very similar to kind of like if you take away, I mean, let's say with Hashimoto's, with those autoantibodies, if you start to decrease those autoantibodies, then your thyroid function goes up, your hormones go up, right? So in pregnancy, I do feel like it's nature's way of calming down that autoimmunity, and then things just start working better. Hormones start
Yeah,
working better. And some women are opposite from that. And so that takes away
totally.
control.
Yeah. Yeah.
But I think women are absolutely resilient. And I would say most patients who suffer from autoimmune conditions feel much better in pregnancy
Yeah.
than outside.
Yeah, it's so interesting and I guess if I'm being perfectly honest, because it's not my scope that I involve myself in much, I've kind of always thought of it from what you mentioned, like depletion. Like I've thought of a pregnant woman's body under a lot of stress and duress because of the depletion and everything that's happening. But you've kind of opened my mind to, well, yeah, but also the body is regenerative, resilient, and adapting to what's needed and making that happen internally. And so it does make sense that I've had plenty of women say, I used to have Crohn's. I used to have all these food sensitivities. I used to have Hashis. And then it went away after pregnancy. And in my mind, I'm like, it didn't go away.
Yeah.
But but it did.
Yeah. And then you also, on the flip side, something that I see quite frequently too, is women who are previously healthy, who had really, really, really great pregnancies, and then 6 weeks to 12 weeks postpartum, all of a sudden are hit with chronic symptoms.
Yeah.
And in that sense, I still think the body, it goes into preservation mode, but then that excessively large hormone dump once, within the first 24 hours postpartum, that is kind of the trigger to then activate something that was probably looming all along.
Yeah.
But I do get patients on the reverse who start with chronic symptoms postpartum because I do feel that because pregnancy can help suppress some immune functions that are going on, and then that's gone and it's gone very quickly and abruptly that now our immune systems are triggered into this heightened state. So it's not uncommon for me to see it on that side too.
Yeah. How much do you feel that postpartum depression is potentially just unaddressed hormones, imbalanced hormones?
Balanced hormones and micronutrients.
Yeah.
I have not had any patients who have postpartum depression who have not had one of those. Simple micronutrient deficiencies or hormone imbalances. I'm not going to say most, I would say maybe 55 to 65% also have some sort of GI issue going on, lack of absorbency.
Neurotransmitter dysfunction.
Exactly,
Yeah.
exactly. So for me, postpartum depression, yes, that huge shift of estrogen dumping after giving birth can absolutely contribute to mood changes, 110%. But if those mood changes are lingering and lasting, that is a reflection of deeper error going on.
Yeah, makes total sense. How often, outside of your practice, how often is it that women actually do blood work and hormones postpartum?
Yeah,
Never.
I mean, so just to use myself as an example, my first two kids born in a hospital, my second two kids born at home. So I've had every type of birth you can imagine. And after my first two in the conventional, I remember sitting in the office down in Florida, and it was just a piece of paper where you check off, do you have depression? Are you anxious? Okay. Am I
Wow.
going to tell the truth on that piece of paper, or can I simply just check a box that says, no, I'm good, bro? Like,
Wow. Yeah.
I was
Yeah.
25 at the time with my first one, so I was like, nah, I'm good.
Yeah.
But with my first one, I had severe postpartum depression, and only my husband saw that, but on a piece of paper, you can lie. And there wasn't any labs. You do, you go, you give birth, and then if you're in the hospital, they see you the next day or the day before discharge, and then you go back 6 weeks later, and that's it.
That's it. Yeah.
That is it. So that's where I come in. And yes, I'm very protective of my women who, even if they're perfectly healthy and beautiful, I always say, when you are ready, and I'll give it to them in the third trimester, I'll say, when you are ready, whether that's 4 weeks, 6 weeks, 8 weeks postpartum, because you also don't want to burden them with, oh, let me go get my blood drawn and then this information. But when you are ready, these are the labs that I would suggest to do postpartum. I always give my postpartum women before they are postpartum. So again, like third trimester, I like to have a check-in that goes through a couple things. We won't divert down this tangent, but that goes through choices. What are choices I didn't know I have? What are choices if I do have group B strep? What can I do outside of antibiotics at birth? What can I ask for? What can I do? What are my choices if my blood pressure is going high? What are my choices in terms of actual birth, labor, delivery, the first choices that you make for your child while in a hospital? What are my choices there? Let's talk about them. So I always like that third kind of trimester check-in to go through all of those, make sure women are confident, comfortable, and understand and making educated, informed decisions. But then also to make sure that they have the supplements on hand to be taking in that postpartum time.
Yeah.
Yeah. Because that's not given. Now going into the home birth world, midwives, I had a wonderful midwife in Florida. I don't want to knock her, but mid home birth midwives are exceptional for, hey, bring this tincture, have this, this is what you can do. You still really only get those two check-ins postpartum,
Mm.
but they are at least more just comprehensive and making sure you're taking the right things, taking the time to ask what you're taking, that you're rebuilding your bones and your blood and just your mitochondria function and really nourishing yourself.
Yeah.
So if women don't have that, I absolutely put that plan in place for them so they're confident and know what to take.
Wow. Very informative. Again, I feel like we could go hours. I know we're so busy, so I want to try to wrap this up, but I want to have you on again. We have way more to talk about. Way more to talk about. My last question for today is for women and viewers who have been interested in everything we've talked about. Do you offer one-off consults to maybe a woman who's considering pregnancy or just wants more information about themselves in that regard and their fertility capacity? Do you do one-off consults like that?
Yeah, so in practice, I always transparent, as you can tell, but in practice, my new patients are like 4 months out. So I really have to differentiate between the people I take care of in my practice. Pregnant moms will always have my heart. I went through cholestasis in my first two pregnancies, was told that there's nothing you can do about it. I mean, crying, itching for months before delivering, bruises all over, and there's, quote, nothing that you can be done. And then reversed it in my third and avoided it in my fourth, and now in my fifth, I'm chilling. So pregnant women will always have my heart because regardless of what conventional medicine tells you, there is always something that can be done to better your health, to optimize it, to reverse something, to minimize something.
Yeah.
So with that said, through the Discovery Doc, the only one-off consults I'll have right now because of time and kids and my clinic is with pregnant women. And
Right.
so that is a good kind of just introduction to say, okay, should this become an actual patient in my practice, or is this someone I can kind of help on the side through my educational platform, where I can help monitor you alongside the OBGYN? So
Yeah.
to answer your question, yes, just tends to be on my own time versus my clinic time because it's not helpful if you're pregnant now and you have to wait 4 months to get in.
Right. But if someone maybe was thinking in a year from now, this
Yeah.
would be a good time to go ahead and start that process.
Absolutely, yes. Or if you are suffering from more chronic conditions already or symptoms like that, I always prefer to just keep things in my practice because it mainstreams it for me. It makes it much easier to just chart and keep everything together. So if there are any things that are going on currently, then absolutely give us a call, schedule with us. I have another really awesome adult practitioner who I trained, who's really, really good, and another pediatric provider,
Awesome.
who's amazing.
That's great. Where can people find you? So yeah, contact information. What is the best way for people to reach you? Um, YouTube's podcast. Give us everything so that people can learn more and get in touch with you.
Yeah, so I kind of have two sides. One is my online educational platform, which is the Discovery Doc. So thediscoverydoc.com. I have a bunch of resources, guides, free guides, also paid guides that go through everything. I mean, mom, baby related, non-toxic living, you name it. So that's definitely more of my educational side. And every platform there is at the Discovery Doc, whether it is Instagram, TikTok, YouTube. I do have a podcast. We're on a little hiatus right now until after I have this baby, because as you know, it can be a lot.
Yeah.
Um, but every platform is at the Discovery Doc. And then my practice is Discovery Wellness Group,
Okay.
discoverywellnessgroup.com, and on Instagram and Facebook, Discovery Wellness Group. And we take patients virtually, in person. We have patients all around. So you can reach out directly either through our website or you can email new patient at discoverywellnessgroup.com.
All right. Awesome. Well, Dr. CeCe, thank you so much for today. Again, I'm going to be reaching out soon to set up another call or another episode because this was great information. And again, it's not something I'm hearing talked about very often. So I think our viewers are going to love it. They're going to really appreciate it. I hope that there's some take homes for the women listening, and I actually hope that some of them reach out to you and continue further information. But again, I just really appreciate your transparency, your insights, your ideologies, and your practice, and I look forward to doing this again.
Thank you so much for having me on. I always love these conversations so much. I think it's a chance for both of us to educate anyone who
Oh,
might be listening. So I really appreciate it too. It's been great.
yeah, well, you have a great day. I know you're busy, but we'll be connecting again soon.
Thank you. You too.